Hi, my name is Christopher Heaton, and in today's workshop we will be talking about stress and how to manage it so it doesn't manage you in your everyday life. Now, everyone has stressors in their lives, but how we manage it and prevent negative stress is very different from person to person. Here I will teach you how to better manage stress so you can live your everyday life better and more efficiently for yourself. In this workshop we will be going over three main objectives. 1. Learning what stress is and its effects. 2. Reviewing myths and misconceptions about stress in general. And 3. How exercise affects stress and how to prevent stress. These three objectives will help us manage stress better by the end of this workshop. Now, 3 questions I want you to keep for yourself are: do you know what stress is? What have you heard about stress? And what do you know about exercise and its effects on stress? Now, defining stress and seeing how it affects the body is very important. The medical definition of stress is a physical, mental, or emotional factor that causes bodily or mental tension. Now, stresses can be external, meaning from the environment, psychological, or arising from social situations, or internal, meaning they come from illnesses or from a medical procedure. Now that we know the medical definition of stress, we can focus on where in the body stress affects specifically. Now, in an article written by Dr. William Shield Jr., it is stated that stress affects your brain, nerves, muscles, joints, heart, stomach, pancreas, intestines, and the reproductive system. Specifically, stress can cause constriction of blood vessels in many parts of the body, decreasing functions there. It also causes the decretion of nutrients for muscular action, primarily in fat and glucose. Nerves are also seen to be less stable, which can decrease spinal reflexes or even causes the body to shake in certain circumstances. Stress also causes the acceleration of heart and lung action, which can cause paling or flushing coloration of the skin, depending on whether blood is leaving or entering that part of the body. It can also cause an inhibition of the action in the stomach and upper intestinal regions, where it can cause digestion to slow down or even completely stop in some instances. Now, in terms of the reproductive system, when there's less blood flow down there, there won't be any erections, which can cause problems in that area. As also stated in the article, when these bodily areas are affected, medical problems can arise, such as poor healing overall in the body, high blood pressure, as well as other diseases such as irritable bowel syndrome, which affects the digestive system, and can lead to psychological problems such as depression and anxiety when maintained at a high level. These can be prevented if maintained at the lower levels. In this diagram, we can visually see where in the body stress is affected, as we talked about in the last slide. Here we can see the brain and nerves, the muscle and joints, the heart, the stomach, pancreas, intestines and digestive system, and reproductive system affected. Now that we've talked about the definition of stress and how it affects the body, we can talk about the misconceptions of stress. One big one is that people associate stress and anxiety as the same thing, whereas they're different. The difference between them is that stress is the response to a threatening situation, as anxiety is the reaction to that stress. Now, anxiety is stated as a temporary or persistent feeling of apprehension associated with acute or chronic activation of the sympathetic nervous system. And stress, as we've talked about in the last slide, is bodily or mental tension. Another big misconception is that a lot of people think all stress is bad, when in fact it's not. An article by Ben Webb, it helps state that stress is good in the form of eustress, but normally we see it in the form of distress, which is why we perceive it as harmful or bad. We can also see stress as a psychological stress, which is associated with cognitive processes, and we can see it in the form of physical stress, which is associated with physical trauma, injury, illness, disease, exposure, or exertion. As with misconceptions, many myths have arisen about stress over time. Two common ones are that stress can cause ulcers in the body and that alcohol can help relieve stress. Now, in an article written by Sarah Klein, it states that most ulcers are actually caused by an infectious bacteria called H. pylori, or can be caused by long-term use of anti-inflammatory drugs such as ibuprofen. Stress helps contribute to ulcers by decreasing the efficiency of the immune system, making it more susceptible to these infections. Now, alcohol soothing stress. Alcohol stimulates the production of the stress hormone cortisol and can disrupt sleep, making more stress on the body. Increasing alcohol consumption in the hopes of managing stress only taxes the body more, creating more stress for yourself instead of decreasing it as one would assume. Moving on to our last objective, we can see what effects exercise has on stress. Now, in an article written by Harvard Medical School, it's seen that the mental benefits of aerobic exercise have a neurochemical basis. Exercise reduces levels of the body's stress hormones and can be seen to stimulate the production of endorphins, which are the chemicals in the brain that are mood elevators or can be seen as the body's natural painkillers. Now that we know that stress is reduced by exercise, it's a matter of which exercise to do to reduce that stress. As also stated by Harvard's medical school, breathing exercises as well as aerobic exercise and mental exercises are beneficial to reducing stress. Many forms of exercise reduce stress directly and forms by reducing that tension, which can be bodily or mentally straining. Now, these exercises are chosen to maximize the amount of stress reduced by doing so. But which certain exercises can do so? A balance of both strength training, cardio, and slow and fast movement patterns are important in reducing stress. Aerobic exercises such as walking, meditation with yoga, and breathing exercises such as relaxing muscles in your face are excellent examples of stress-reducing exercises. Meditation and breathing exercises can help reverse the physiological signs of stress by using the deep, regular breathing patterns, which mimic the opposite of the rapid, shallow breathing patterns, which are associated with stress responses. On the diagram to our left here, we can see a breathing exercise being performed where the chest is expanding and contracting to push air out of the lungs. On the diagram to our right here, it is also noted by Lauren Parsons in an article that confirming aerobic exercise, meditation, and breathing treatments are the key exercises used to reduce stress. With the information we learned today, I want you to be able to take this information and execute it in your everyday life to maintain those low levels of stress that we talked about. We learned today what stress is and its effects. We reviewed the myths and misconceptions about stress in general, and we reviewed how exercise affects stress and how to help prevent stress. Now, how can you fit these techniques in your daily schedule, and who can you teach these methods to that we talked about today? Thank you for listening, and I hope you enjoy this workshop.